And one of the things that happens when people experience spirituality is that they start to change their goals in life. They become less materialistic. Before yoga, their goals were, well, I want to have a huge house in the suburbs with 3-car garage filled with Mercedes, and I want to be famous and I want to be powerful. Those are very common materialistic goals in modern society. And when people go through the transformation that yoga can provide after significant amount of regular yoga practice, that changes. People start to experience these unitive states of consciousness. And those states start to make a transformation. And people will say things like, yoga changed my life. And it's because they've changed their perspective of who they are and what their goals are.
Good morning, good afternoon, good evening, good night, wherever you are. This is Sandesh on the Kundalini Awakening Podcast, from Karma to Dharma. And today I really have, I know I'm really excited with many of my guests. And today I'm super excited because most of us go into the Kundalini Yoga because we want to move towards the heart, the feeling, the senses. But I met somebody just the last summer at the Kundalini Yoga Festival in France who actually said, no, I need to be in my mind because this is how I serve the Kundalini Yoga and the yogic community the most. And his name is Bir Singh Khalsa. And I'm so touched that he's here. Thank you so much for making the time on this podcast to share your experience in Kundalini Yoga or yoga research, right? Tell me very short, how many years have you been doing yoga research?
So I began doing research on yoga actually in 2001. And so it's been my full-time research job to do that work since that time. So it's a short period of time. I got my PhD back in 1985. So it's taken a while. Then I was able to finally get the funding to actually be able to conduct research on yoga.
And how many years so did you have that desire already before you finally could achieve this moment of having funding?
Yeah. So I began Kundalini yoga practice back in the fall of 1971, and I moved into an ashram. And in the mid 70s, I had the desire to understand the science behind how yoga makes its transformation, because I was always interested in science, and having experienced Kundalini yoga and ashram life and so on, I set a goal of wanting to do research on yoga in the mid 70s. So I went back. I had my bachelor's degree already. I went back and got additional training and then went for a PhD. I couldn't do a PhD in yoga because nobody was doing research in that area. So I got my
Did you ask them?
PhD.
Did you tell them that? How would they react if you told them that?
I actually was very, quiet about who I would tell about what my ultimate goals were.
Oh.
I happened to tell the chair of the Department of Physiology when I was looking for a mentor for a PhD. I happened to tell him that my ultimate goal was to conduct research on yoga. And his response was very interesting. This was like 1978 or 79. And he said, well, if that's your goal, I suggest that you don't go into a research career at all. So, but of course, I was in my 20s, I was indestructible, and I just continued. But yeah, no, it was not something that people were doing really at that time. So I got my PhD in neuroscience and continued to work in the field of neuroscience without really any sort of opportunities to get into yoga research directly because there was no funding for that. So I found myself finally at Harvard Medical School, starting in 1996. But then funding came available actually from the US government for complementary and alternative medicine. So I was successful in writing a grant application, which I was able to actually then full-time engage in yoga research in 2001.
Wow. And since that time till now, what have you unlocked?
So, my original interest actually was in these altered states of consciousness and samadhi, and understanding how that works and how that happens in the brain and how yoga makes that happen in the brain. Unfortunately, that's not something you could get funded even in 2000. So, what I got funded were basically clinical trials. So I was funded to do research on yoga for insomnia. And that morphed into other mental health conditions. So over the past 25 years, I've done clinical trials on yoga for music performance anxiety, yoga for post-traumatic stress disorder, yoga for generalized anxiety disorder. And then we've also done studies on yoga in the public schools and then yoga in the workplace. So these are all basically clinical, sort of beneficial psychological applications of Kundalini Yoga and its benefits. And it's just now that I'm semi-retired that I'm actually starting to look more at what my original interest was these altered states of consciousness, essentially spirituality, the science of how yoga manifests spirituality.
Mhm. Wow. And this world of yoga and research, why is it so necessary?
So what's really powerful about science and research is that the language of modern society is the scientific language. And it's the scientific language that is the basis of all modern societal institutions, whether we're talking about the healthcare system, or whether we're talking about the workplace, or whether we're talking about the education system. Everything that gets implemented in those systems has to be basically scientifically based. So if you wanted, for example, to give yoga to cancer patients, you would go to a cancer clinic and you'd offer your services. You'd say, okay, I want to offer yoga to your patient population because I believe it can help them. And the understanding of the value of that by the clinic director is going to depend upon whether he or she understands what you are trying to do and the value of what you're trying to do. So if you go in with yoga language and you say, I want to help your cancer patients with yoga, the clinic director will say, okay, great. How does it work? Well, as a yoga teacher, you're trained in yoga language. So you'd start talking about prana and kundalini and auras and so on. And you'd go on like that for a little while, and the clinic director would say, thanks very much for coming in, and that's it. But if you come in with research scientific language and you talk about the constructs that we know that underlie how yoga works from the research that's been done in the past 3 to 4 decades, and you start talking about changes in flexibility, changes in respiratory function, changes in stress regulation, changes in emotion regulation, improvements in mind-body awareness and metacognition, and then potentially even these deeper states of tranquility, peace, and calmness. And you start talking about the evidence, and then you bring a couple of reprint papers that have shown a study that's been done on yoga for cancer patients, or even a review paper that summarized 20 to 30 papers that have been done on research on the benefits of yoga for cancer patients. And then you emphasize what specifically cancer patients really need, like improvements in sleep, which is based upon their stress level or their chronic stress level itself, their mood disturbance. And then even from the spiritual perspective, these are potentially end-of-life diseases. So, what's their place in the world? What's their sense of life, meaning, and purpose, and how yoga can facilitate improvements in that. You start talking about the relevance of the science to the patient population. The director is going to know that patients have a real problem with stress, mood, and end-of-life issues, and he or she's going to say, "When can you start?"
Wow.
And that's the difference. And so that's the value in a very small context. But even in a broader context, if we're talking about, let's say, the public schools, if we're talking about bringing yoga into the public schools, and adolescents have a huge mental health problem around the world, suicide rates are huge. If we talk about bringing yoga into schools, and we're going to convince a policymaker, someone who is a district supervisor over hundreds of schools, and we convince that individual that there's value in yoga for these students, and that then turns to be implemented over a course of an entire school district, you're talking about now hundreds and thousands of students being given these practices. So that's the power of bringing yoga into mainstream societal institutions. And it's the research that really facilitates that, both the evidence and the language.
Now, did you already foresee this when you had this first desire to do research in yoga?
Well, actually, to be honest, that my original goal, as I said, was to really understand these altered states of consciousness, which
Yeah.
of course has value. Actually, modern medicine is just now starting to realize the importance of spirituality as a construct, that it's a really important construct. And there's research being done on spirituality in medicine, and that's just now starting and growing. But that was my original goal. But, having started with clinical trials and then basically working in the research medical field, it became very clear how much suffering there is in terms of mental and physical health conditions. I mean, non-communicable diseases, these are lifestyle-based diseases. We're talking about hypertension, obesity, type 2 diabetes, and even 50% of cancer is preventable. 90% of all deaths are due to non-communicable disease. 90% of healthcare costs are due to non-communicable disease. And from this perspective of adolescence, statistics show that that 9% of adolescents are actively contemplating and attempting suicide. So these are huge burdens. And we know that yoga has such a benefit for preventing these conditions and even treating many of these conditions. So that has become clear to me and has become something that's very important. So I always talk about the importance of yoga being implemented into modern medicine, both as prevention and then also as treatment.
Hmm. Having done all of this and now semi-retired, right? What are you still looking to achieve? Because
I'm still involved in what I've been doing, and over my 25-year yoga research career, which is still continuing, my three major actions, areas of work have been, first of all, conducting research. So I've conducted many research trials in the areas that I've mentioned. And that is what I have let go in the semi-retirement. I'm now only working as a consultant or a co-investigator on other people's studies. So we have a study on Kundalini Yoga for insomnia going on in Brazil. We have a study of Kundalini Yoga for complex trauma going on in Australia. We're planning a study on yoga for spirituality as a survey study. I'm still involved as a co-investigator and consultant, but I'm no longer conducting studies, but still involved in research. And the other two areas, one has been serving to promote actual research on yoga. And that I have done through coordinating an annual symposium on yoga research to bring yoga researchers together. We've conducted this 14 times and continue this work with the International Association of Yoga Therapists. I've served as the chief editor of the Principles and Practice of Yoga in Healthcare, which is a medical textbook that really argues and presents the evidence for the efficacy of yoga in modern healthcare. There's over 100 yoga research authors internationally who've contributed to this book. And so that has been another way I've been trying to promote yoga into mainstream society, into mainstream healthcare. And I also coordinate an email list of yoga researchers. So I basically give announcements on upcoming yoga research conferences that are happening, job openings that may happen. And then I also attend and present at yoga research conferences internationally, both in Europe as well as in India. So that's my sort of promotion of the field of yoga research, to make it blossom, to make it continue to provide support, resources for it. And then the third activity, which is still continuing full-time, is education. And this is, for example, this podcast, where I'm able to talk to people about the science of how yoga works, to give yoga teachers and yoga therapists a new language to a new way to talk about yoga from the scientific perspective, based upon the research evidence over the past 100 years of yoga research, where we now understand a lot of these constructs, a lot of these psychological and physiological changes that we know take place. And that kind of education is giving not only the research evidence to yoga teachers and yoga therapists, but also this new way of talking about yoga. So we're talking the science of yoga in modern language. That example I gave about the clinic director is exactly that. It's just, how do we frame this? How do we talk about this? And then orient it to whatever population the yoga teacher or yoga therapist is working with.
It is so special, really. It's as a Kundalini Yoga teacher and connected to many other teachers, I know it's very valuable, because many yoga teachers are being said that, oh, isn't yoga just airy fairy, etc., and then you just get put into a box that is very hard to build a full-time occupation out, right? And I'm so admiring your field. Tell me, how many yoga researchers in the world? What's the trend, and what are you seeing in the yoga research world?
So the increase in the number of researchers and the number of publications is really, it's exponential. I mean, it's really growing by leaps and bounds. The majority of, if you look at where the research is being done, the majority is definitely from Indian researchers. And India has really promoted yoga quite a bit through their prime minister, who's really been a very strong advocate of yoga in society. So that has really shown a lot of increase in research that's been done in India. United States is the second place leader, and then other countries such as UK, Australia, those and some studies in Germany, and surprisingly, studies that are being done in Iran and Turkey are growing dramatically. So there's studies also being done in China. So it is growing astronomically, both in terms of the number of researchers as well as the number of publications. My running list of email researchers is 3,000 at this point in time. And when I send out an announcement, I get very few unsubscribes. So these people are still actively interested and involved in research on yoga. So the field is growing really remarkably. And that is also paralleled by the increase in the popularity of yoga in the public. So, for example, in surveys we have in the US, we're now at 16% of the population of the adult population in the US has practiced yoga within the past year. So that's grown since 5% in the year 2001. So it is really growing in popularity as well.
And when we talk about yoga, it's very broad, right? So many forms of yoga. And I'm sure that not one form of yoga is the key to everything. But what would you say as the main components of yoga that you see the efficacy really showing up in the research?
Yeah, this is an important question because yoga is a small word, but it has many, many interpretations and manifestations on the planet. And of course, one of the major manifestations is just as postures. So there are many yoga practitioners who do nothing but postures, and it's a workout. It's very basic. It's just physical. That's it. And it's a very limited form of yoga. So there's no meditation. There's no breathing. There's no mantra. There's no relaxation. It's just postures. And that has value. It is yoga because they are doing yoga postures, but I refer technically to this as limited yoga. So most of the researchers who are doing yoga are scholars. They understand what traditional yoga is. And traditional yoga, and the yoga that is mostly published, incorporates 4 major components. One, of course, is the postures and exercises. Another important component is the physical relaxation, often practiced as Shavasana, corpse pose, yoga nidra, this kind of thing. And then also awareness of physical tension. Another component, which is really important, is pranayama. Most importantly, the slow, deep breathing, diaphragmatic breathing patterns that we have in yoga, as well as all the many other breathing techniques that we have in yoga. And then finally, and I would say most importantly, is the meditative component. And as a scholar and as an academic, and my colleagues would probably agree with this, that there's an argument to be made that that's the most important component of yoga, the meditative component. And that you could even argue that the physical components are there to facilitate and enhance the meditative component of yoga. So it's those four components that what we see in yoga research. Now, of course, different styles of yoga may have a different emphasis. Some styles of yoga would emphasize more the physical. Some would emphasize more the meditative or spiritual aspects of yoga. But under that umbrella, it's those sort of four components that really manifest as yoga in the research literature.
Mm. And just for curiosity, why did you say that maybe the meditative practice is most important? What do you get from that? What are you seeing? What is research showing?
Well, the research is really showing that it can change mental functioning. It can change life perspective. It can change life goals. It can change life meaning and perspective. And that is very profound, because we not only have medical challenges in modern society with this epidemic of non-communicable disease and this huge burden of mental health problems, but we also have a problem in modern society, as we've always had in human history, of human behavior. And that manifests as poverty, basically inequity in terms of wealth. So there's many people in the world who are in hunger and poverty, and many people who are extremely wealthy. And these disparities and these problems in modern society come from human behavior and human mental health perspectives. So if we're talking about greed, we're talking about this disparity in wealth and poverty. If we're talking about the hunger for power, we're talking about war. We talk about anger, we're talking about war. So these are major problems in modern society. And yoga can change those behaviors by changing the underlying mental health constructs. People become less angry. People become more compassionate. People become less attached to materialistic goals in life. Those are extremely fundamental characteristics. And one of the things that happens when people experience spirituality is that they start to change their goals in life. They become less materialistic. Before yoga, their goals were, well, I want to have a huge house in the suburbs with 3-car garage filled with Mercedes, and I want to be famous and I want to be powerful. Those are very common materialistic goals in modern society. And when people go through the transformation that yoga can provide after significant amount of regular yoga practice, that changes. People start to experience these unitive states of consciousness. And those states start to make a transformation. And people will say things like, yoga changed my life. And it's because they've changed their perspective of who they are and what their goals are. And suddenly those materialistic goals now become meaningless to them. And they want to serve, and they want to engage in ways that provide satisfaction on a deeper level. They express more kindness, more compassion. And there's less of these negative mood states like the anger and the greed and so on. So you're basically, if you're able to get yoga into the world, you're going to make better people. And better people make a better society, and that makes a better world. Not only from the perspective of human functioning and people living together in peace and harmony, but even ecologically. people become more compassionate to the planet. So we're not just talking about something that's trivial here. We're talking about changing human goals in life and human behavior with this yoga practice. So that is why this can be so entirely significant. And that's why, to me, one of the most important places that yoga can be implemented is in the public schools. For me, that is the place where yoga belongs. Yes, education is about learning to get a job. You learn science, mathematics, languages, and so on and so forth in order to get a job. But you need to also learn how to become a functional, positive human being. And yoga can provide that. That's why yoga needs to be implemented in the schools. So for me, that is critical. I like to talk about a thought experiment. Imagine that every school in the country, in your country, has yoga as a regular practice, and that this is happening from preschool right through college and university. You have changed the entire society within a couple of generations. That is the potential of these practices.
Well, I completely agree. I have many conversations with conscious parents who do the yoga, and some who are also teachers sometimes, Kundalini yoga teachers or teachers. They agree that, we're just being prepared to work, but there's a whole beautiful body technology that we have. We don't have the manual for that, right? We don't know how to use it. And my daughter, I've been uh, raising her with Kundalini yoga and coaching her, uh, combining them, and she knows when to meditate, and she knows how to reflect on things that arise. And I get compliments all over the place that she's such a conscious person. She's considerate. Yes, she's in puberty, but doesn't mean she just thinks about herself. She has the ability to look at a different perspective. So I completely agree with you. Now, how could we do that? Can we reach all these Kundalini yoga teachers that we have in our Sangat? What if you had like this magic wand and this army of yoga teachers? How to do that? How would you do that?
Well, I mean, I think that getting more Kundalini yoga out into the public is definitely one strategy. There's no question. And I work closely with the Yoga for Youth program, which is a Kundalini yoga based program for teaching yoga in schools and to youth. And we've conducted a couple of studies, and I continue to lecture to the training program in Yoga for Youth. So that is one way, certainly, to get Kundalini yoga out, and that's happening in the grassroots level. KRI is certifying whatever it is, 6,000 yoga teachers a year, every year. And so bringing Kundalini yoga into society by teaching more and getting out into the public is definitely one way to go. That's the grassroots level. Now, one of the problems with the grassroots level is that yoga is not easy to get for everyone. It's not accessible. It's mostly accessible to people who are better educated, people who have higher income, who can afford to travel, who can afford to get childcare when they're attending a yoga class. I mean, these are basic fundamental issues. And that there's even cultural barriers. Blacks and Hispanics don't have necessarily a relationship with yoga practice per se. So it's really reaching the privileged sliver of society, if you will. And that goes together with higher income, higher education, mostly white. And so we're missing most of the population. And the only way to get to that population is to bring yoga into places where they are. And all of the children are in schools, regardless of minority status. So if we bring yoga into schools, we get everybody. If we bring yoga into the healthcare system, then the doctors will be giving yoga to the patients. If we get yoga into the workplace, then the employers will be encouraging their employees to be practicing yoga at the workplace. So bringing yoga into societal institutions is a way of reaching everyone in a much broader context than we could ever do by doing it in a grassroots level of just basically teaching to the general population because of that disparity. So I think both are necessary, both are important. But for me, the value of bringing it into mainstream societal institutions is where we can get the biggest bang for the buck, if you will.
Okay, let's zoom in on that a little bit. Well, maybe a lot. I don't know. I feel let's do that. Imagine, okay, what are the main three wins for uh, people in the educational uh, um, in the institutions? What are the three things that you would say? Okay, if you bring in yoga, you would get this more out of you or your students. What are the main three things? Three
So
wins.
the first one I would say is really mental health. Um, Most people don't recognize the huge problem that we have in mental health in our children and adolescents. Almost 20% of adolescents have contemplated suicide. 9% of adolescents have actually attempted suicide. That's just depression. Then there's all the other mental health conditions. There's substance abuse, there's bullying, there's anxiety, and these are huge problems. So our children are suffering to a high degree with mental health problems. So I would say that that's number one.
And this
Yoga has
leads
been
to the
shown to be very
consumption of,
effective.
sorry, I have to break in, but this actually also leads to the excessive behavior in consuming vaping, drugs,
Yes,
and etc. Right? I mean,
yeah, exactly. All of these mental health problems lead to behavioral problems, because they're entirely linked together. So if you can improve their mental health, you're going to get rid of a lot of those problems. The second thing that I would argue would be that you are improving their actual functioning in school. We've already had some evidence that after yoga interventions, we've seen increases in grades. Because academic performance, of course, is linked to mental health. If a child is suffering from a mental health problem, that child's academic performance is going to suffer. So that what I would say is the second thing, is that they're going to get more out of school by doing that. And then the final thing is this deeper perspective, is that we engender positive psychological states. This sense of kindness, compassion, uh, improvement in positive mental states, and the decrement in negative mental states such as anger, and so on. So that I think is the third one, which we would expect to happen over a longer time course of yoga practice. But nevertheless, on the long term, it's going to make better people with fewer materialistic goals in life.
when you talk about this, I had conversations with teachers how a diminishing population of teachers has to handle more and more children. I can imagine that yoga can also bring more peace into the classroom, make it less challenging for teachers to teach classes, because I hear a lot of stories about how increasingly stressful it becomes on the teaching population.
Absolutely. And we've actually conducted studies on a teacher population and education professionals using a yoga intervention, showing indeed that it is reducing stress and burnout in populations of workers who are under stressful occupations. And teaching is a very stressful occupation. We've had some qualitative studies on this as well. And, for example, one anecdote is that we had a yoga intervention in a school for teachers, and we had one teacher respond after the yoga sessions and said, "I was on the verge of quitting my profession, period. And then it's the yoga that saved me and allowed me to continue in the profession." So it can make that much of a difference to teachers as well.
Mm.
Because they are under extreme duress.
Mm. Yeah, I had a teacher that was coming to me for years, and she said, "I will not skip your lesson. I battle to keep this block free so that I can come to class because it's helped me throughout the week." Yeah, incredible. Thank you. Okay. So if there's any school heads out there, you're listening, you know what to do, right? This is just, you cannot say no to this. And how often would it need? Like, what's the frequency that you're seeing that yoga would be beneficial?
Well, that's a great question. And, and in clinical trials, we don't know dose response curves yet. When you go into a clinical trial of yoga, let's say for post-traumatic stress disorder, how much yoga do you need to help these patients? How long does it have to happen? And we don't have the answer to that. We sort of go on our intuition and our experience. And oftentimes the intervention will be typically 8 weeks long, and we'll have them do maybe 2 classes a week with maybe a 20-minute practice at home every day. Something like that is feasible in clinical trials. But the question is, how much does an individual need? Well, the more the better. My personal experience was that if you do 1 yoga class a week, you will have some inkling that something is positive is happening. If you practice yoga regularly, 2 classes a week, there is a palpable, very clear improvement that you experience. And if you practice 3 times a week, you start to transform. You start to really change very quickly. And this can happen over the matter of months or certainly weeks. You can start to see these changes. So, and these days, of course, we have many opportunities to practice on our own. There's DVDs, there's online classes, and so on, a lot of virtual classes available. So people can learn to practice in person with a teacher and then go on and practice yoga on their own with websites, DVDs, yoga manuals, etc. So, but I think the more the better.
Thank you. Okay, let's talk about that workplace. What are the main 3 benefits of bringing yoga into the workplace if you had to talk about some big CEO with a whole bunch of offices?
Well, when you talk to a CEO, you will need to talk to whatever it is that's really important for them. And important for them, of course, you're running a business. The bottom line is profit. Profit means productivity in the workplace. Productivity means, are your employers productive? Are they working? Are they making good productivity? So that's number one. And we improve productivity twofold by reducing mental health challenges that workers are experiencing, whether that's insomnia or whether it's anxiety or whether it's depression, and then improve their mental health functioning in terms of better cognitive functioning, better creativity. And that mental health improvement is substantial because you basically make people who are more creative, more productive. Creativity is enormous. I mean, you can have people doing this mundane task taking 1,000 hours. And then someone who's in that environment who becomes creative finds a way to do that same 1,000 hours of productivity in 100 hours by thinking outside the box. And that's the whole virtue of creativity. And creativity only manifests if you're not burdened by mental health challenges like depression, anxiety, trauma, etc. So it's really the mental health, both in terms of reducing the mental health burden and increasing the cognitive and creative performance aspect. And then, of course, there's many, many other considerations in the employee world. I mean, one of the consequences that occurs very common in the workplace is people quitting. And that means job turnover. The cost of job turnover is huge. Not only do you have then a breakdown period where that employee is gone and you have to somehow cover for that employee's effort by bringing in other employees or doing something else or bringing in a temporary. The other problem is that you now have to hire and train a new employee. And I can tell you the costs of that are astronomical. And if you have a large amount of job turnover in your corporation, you are spending an enormous amount of resources that are going to nothing. And so basically making people who are happier in their jobs through experiencing better internal functioning, you're saving a lot on that job turnover. So that's really another feature. And then finally, I think, again, coming back to the positive psychology, you're making a positive workplace. You're making a workplace that people want to be in. There's less interpersonal conflict between employees. There's less dissatisfaction on the job. There's more a sense of belonging to a community, not just a job. That can be facilitated by yoga as well. And again, that comes through better kindness, more compassion, less anger, etc. Again, improving positive functionality makes a workplace that people want to go to work instead of just going to work because they have to make money.
Yeah, and that all just to have a yoga teacher come in a few times a week and sit in front of 20, 30 people, right?
You know, it really is as simple as that. If you do these practices, they work. They work because they're biological mental changes. And if you practice the yoga, regardless of whether you believe it works or not, it still works because you are a human and humans have the same functioning. We have the same brain functioning. We have the same body functioning. And if you do these practices, the postures, the pranayama, the relaxation, and the meditation, it changes you, period, because that's the way we are constructed as human beings.
So if we bring it to schools, we get healthier children who are much more in sense with their surroundings. They are happier. So when they go into the workforce, as go into leadership, they will think differently. They will completely, I think, the way we operate as businesses, we would change. Instead of competition, more cooperative, right? And if we would do it now for the people in the workforce, we have less cost in turnover, we have less cost in illness, more productivity, and I think the amount of burnout would go down, which is a huge trend, right? Burnout
Yes,
is just
burnout
rising.
is a major challenge, especially in stressful occupations like education and healthcare.
And have you done research on that yoga and burnout to prevent it, or it's
We've
just
done studies on healthcare workers. In fact, we did 2 studies at Harvard Medical School with Harvard doctors. These were 6-week yoga interventions, Kripalu yoga interventions. And we found reduction in burnout in both Harvard physicians and Harvard medical residents who are doctors in training. And these were statistically significant improvements in burnout scores that were maintained at a 2-month follow-up.
wow, incredible. Wow, that's such an important field. Some successes are there. You just told about that before we went into this talk, and a friend of mine. I was in Sweden. You're right. In Sweden, they have yoga as they have accepted mainstream yoga, right? Can you tell us about what happened there and how? What do you know about yoga in Sweden?
So this was actually started by a yoga teacher named Göran Boll, who's a Swedish Kundalini Yoga teacher. And he found it important to teach yoga in the medical system. And he created a program he called Medi Yoga. Medi Yoga is basically applied Kundalini Yoga to patient populations. And he worked with this in Sweden and grew this organization, Medi Yoga, and then eventually sold it. And Medi Yoga is continuing on its own. It is virtually in hundreds and hundreds of clinics across Sweden. And it has also been taken up as research by many of the leading academic institutions in Sweden. So we now have several dozen publications on Medi Yoga that give evidence for the efficacy of Medi Yoga in Sweden. So it has basically, really become very prominent in the medical system in Sweden. And the population in Sweden is only 10 million, but you can see the entire country has been affected by this program.
And the benefits thereof is are people then also because my insurance base for health insurance is getting higher and higher every year. Is applying yoga reducing, and are we seeing that in Sweden, the medical cost, or
There haven't been sort of cost effectiveness studies really to a large degree at this point in time. And that's something that does need to happen. There's one place where a cost effectiveness studies have been done. One study was done in the UK on yoga for low back pain. showing actually 2 studies that were done in the UK on the cost effectiveness of yoga for low back pain, showing that it is cost effective. And we need more studies like that to really convince the medical community that it's not only another therapy, which is important. To have another therapy, another option for patients is important. But to show that it's also cost effective, that it potentially is the same price or even cheaper than conventional therapies, is important.
Yeah, incredible. Is there anything you would like to tell to Kundalini Yoga teachers that are now, they feel the efficacy of Kundalini Yoga, or other yoga teachers, that how you could inspire them to use what you've used to broaden their impact?
Yes, actually, I would. And there are several organizations that are Kundalini Yoga based, that they can go to for resources and for education. So I work as the Director of Research for the Kundalini Research Institute. Now, the Kundalini Research Institute, its primary goal and primary activities is really in teacher training and maintaining the teachings of Kundalini Yoga. However, we do have resources on the website which provide information on research. We have all of the publications that have been done on Kundalini Yoga available on the KRI website. So a teacher can go to the KRI website, log in, and have free access to all of the publications that have been published on Kundalini Yoga. That's important. The Kundalini Research Institute also has been now coordinating the Kundalini Yoga Symposium on Kundalini Yoga research and applications. Our first all-day online conference happened in February of 2024, and the next one is happening in the February of 2026. And this is a combination of research and application of Kundalini Yoga. So we have presentations of research that's been done on Kundalini Yoga in that symposium. We also have lectures on experts in Kundalini Yoga who've been applying yoga for specific populations. We have Shanti Shantikar talking about yoga as a therapeutic intervention. We have Muktakar talking about yoga as therapy for addictions. We have Kevalkar talking about yoga for youth programs, the application of Kundalini Yoga for children and adolescents. We have many other teachers who are working in different areas. We have breakout sessions in which there's an opportunity to dialogue about applications of Kundalini Yoga. So we have pregnancy, we have Kundalini Yoga for the elderly, we have subtle energy mechanisms, yoga in conflict regions, etc. So many opportunities for yoga teachers to attend this symposium. It'll be recorded, but they can participate online in February. This is listed now on the KRI website. Another organization I work with very closely is the Guru Ram Das Center for Medicine and Humanology. This was founded by Yogi Bhajan, and he trained specifically Shanti Shantikar into how to apply Kundalini Yoga for patient populations for treating medical and mental health conditions. And so the Guru Ram Das Center for Medicine and Humanology is a certified yoga therapy school. You can graduate as a certified yoga therapist through that school, or you can simply take a number of different courses that are available in training the application of Kundalini Yoga for a variety of different conditions, things like depression and trauma, for example. So that's another website that Kundalini Yoga teachers can go to get access to information on that. I also mentioned Yoga for Addictions. Muktakar Khalsa has been running 3HO Super Health for many years, which is a training program for using Kundalini Yoga for treating addictions. And I've mentioned Kevalkar running training programs for the Yoga for Youth program. So then, and then the other thing is that I also lecture at a number of venues. I lecture at the summer and winter solstice sadhanas in the US. I give a yoga research workshop there. And then, as you mentioned, I gave three yoga research workshops at the recent Kundalini Yoga Festival in France. And I continue to give research lectures at all of those venues. And then I also lecture both online and in person to yoga research conferences, to yoga conferences, to yoga festivals. And then I've also been lecturing in yoga teacher training programs, in Kundalini Yoga teacher training programs. And some of those have incorporated my lecture on research to give the yoga teachers not just a training in how to teach Kundalini Yoga, but also this languaging and this scientific evidence behind yoga. And hopefully we will be able to expand that further. I've been arguing for incorporating a lecture on yoga research into our standard Kundalini Yoga teacher training program. And so I'm working with KRI on trying to manifest that.
Well, I'll try and help you manifest that in our training. Well, it is really so remarkable. I want to talk a little bit about you, if that's okay.
Okay.
Let's talk about this young man that decided to take on this huge challenge. What has your personal win been? You went into a field where you were said, if you are going to do that, then better stay out of it, right? No yoga research. And now look at this. You're the coordinator of so many research. You hold this space. You disseminate all the research through all these lectures and interviews, etc. How has it been for you?
So it's interesting. I mean, as I say, I always had a passion for science growing up. I always did well in science. I like science. As an undergraduate, I was taking physics and astronomy. And then when I made the transformation of wanting to adopt a spiritual lifestyle, I moved into an ashram. And I lived an ashram life after I got my bachelor's degree for a number of years. And then my passion for science started to come back. And my vision was that, maybe someday I would be a faculty at a college or university and have a small yoga program going on, yoga research program going on. If you had told me that in 1976, when I had this vision, that I would be faculty, an associate professor of medicine at Harvard Medical School, and conducting full-time research on yoga funded by the federal government, and running an annual symposium on yoga research, and attending and presenting at yoga research conferences internationally, and being the chief editor of a medical textbook on yoga, there is no way I would have believed you. There is no way I had the concept that this could manifest so well. So it has surprised me to a large degree, and I have to pinch myself every day to realize this.
What kept you going on?
Sorry?
What kept you going on, continuing?
Well, the more, it did take a while. I mean, when I established the goal in 1976 to want to conduct research on yoga, I was not able to start research on yoga until 2001. That's 25 years. 25 years of being a scientist in other fields. Now, I like being a scientist. I like science. I like being on the cutting edge of knowledge in the world. And so it's been rewarding to be a scientist in general. But it took 25 years of being a regular scientist until I was able to ultimately really experience my passion of wanting to do research on yoga. So it took a while before that yoga research actually manifested. And my career is much shorter in yoga research than it would have been had I been able to start yoga research when I was a graduate student. And that is possible today, much more so than it was, 50 years ago. So things have changed.
in a way you help to make that happen, right?
Well, I like to think that I facilitated that forward. Yes.
Yes, yes.
And that is anything that I can contribute to the field for me is very rewarding.
So you do the research. How long have you been practicing Kundalini Yoga?
So, as I say, my first yoga class was as an undergraduate student at the University of Toronto in the fall of 1971. I had, as a sort of young person, a member of the counterculture, suburban hippie, if you will, um, uh, had, what was very common at the time was the whole idea of these altered states of consciousness. And as I began reading about altered states of consciousness, I started reading books on meditation and yoga. And the book on yoga, one that I read, said that everything in yoga you do, not just the meditation component, but what you eat, how you behave, how you breathe, all of that is geared towards achieving these deeper states of consciousness. That made a lot of sense to me. So I was an undergraduate student at the University of Toronto, and I happened to overhear some students talking about a yoga course for credit on campus. And I showed up at the first class, and there was a white turban Kundalini Yoga teacher teaching that course. And so, of course, I signed up for the course in 1971 in the fall and got more deeply involved. Started practicing at the ashram, which is just off of campus. I went to my first summer solstice in the summer of 1972. And then after summer solstice of 1973, I moved into the ashram.
And you
So,
kept on doing Kundalini Yoga every day afterwards.
well, in those days, yes, every day we did sadhana as all ashrams did in the U.S.
Yeah. And nowadays, at your age, how is Kundalini Yoga for you?
Well, my frequency has dropped. I'm still in a yoga community here in Millis, Massachusetts. We have an ashram and a yoga center. However, things have changed over many years. The ashrams are not like they were back in the 70s or the 80s. There's much less of that sort of communal practice. And I practice a few times a week now on my own. I still lead sadhana exercises one day a week at the ashram, which is very close to where I live. So I'm still involved with the community and still practicing.
And how's your health otherwise? Other sports? How's
So I am 73. I do street hockey twice a week. I do racquetball twice a week, and then I do yard work. So I'm very physically active, and in playing those sports, most of the people are much younger than me. So there's not many that are my age that are doing those kinds of sports. And I attribute yoga to be my lifelong practice of yoga to keep me healthy enough to be able to do those kinds of activities.
I'm gonna thank you for an incredible conversation. I'm sure that you could say so much more, and I will do my best to help bring your wisdom and experience around. But thank you for being such a um, force in the field of yoga research and leading kind of a becoming a proof of how it is to lead having yoga frequently in your life, being so sharp in your mind and such a healthy physical body. It inspires me. I'm 47. You started yoga before I was born, so but I'm very grateful. Thank you very much for coming on to this podcast and sharing your wisdom. I will make sure that all the important links that you just shared and the people you just shared will be in the podcast description. And I'm sure it's not our last time. Thank you so much.
It's a pleasure. Thank you very much for the invitation.
Yes, Satnam.
Satnam.